I'm Nick Angelis, owner of Ascend Health Center. I'm a nurse anesthetist, and I'm going to talk about concussions. I got one about 2 weeks ago. It wasn't playing soccer with the Golden Armadillos and Team No Name and Aurora Parks and Rec, although you'd think it would be because that's a lot of 6th and 8th graders I was playing with. No, it was trying to block a shot in basketball and someone elbowed me in the head. So I drove myself home, maybe not the first good idea. And by the way, none of this should be construed as medical advice, not because I don't know what I'm talking about, but because I'm not speaking to you personally about your complex neurological condition. So I drove myself home, realized I am failing this concussion test, and immediately stopped doing anything that involved my brain. So no reading, no Googling things on the internet, none of that. At the same time, I was also paying attention to see if my symptoms got any worse, meaning do I need to go to the ER because this pain is getting worse, I'm losing neurological function. And it can be difficult to tell if you should go to the ER or not in some cases. One question is, did I lose consciousness, which I did not. And some of this advice is also coming from Dr. McElrath from Monarch Ideal Care, because I also called her since she's my doctor. And that's also why I was not allowed to read or use my brain basically for a few days, because you have to think of it almost like a sprained ankle where you need to rest the muscle. And I guess your brain isn't technically a muscle, but you get what I'm saying. Now, in the intermediate term, how do you turn off your brain and how do you find out what to do? Because if you can't Google things, how are you supposed to figure out anything? That's what we do these days. So honestly, if you have a concussion right now, don't watch this video. You can still listen to it, that's fine. But the screen time can be difficult for you if you're trying to recover from a concussion. And you do need to rest your brain, which again is difficult in our culture. You can think of it almost like a Sabbath rest, or a way that we always recommend for anxiety at Ascend Health Center, depression, a lot of mental health issues. We encourage you to occasionally just take time out and rest your brain. It's the same for concussions. So long term, there are many cases, unfortunately, and we see this all the time. We have patients who get ketamine infusions for traumatic brain injuries, for the long-term sequela from concussions, among other issues. And their doctors say, no, you're fine. There shouldn't be anything wrong with you, but they're still having brain fog, fatigue, headaches, many of the same things you see with long COVID, Lyme disease, Epstein-Barr virus, a lot of those disorders where the medical community usually says, you're fine, what's wrong with you, you're faking it. So one thing you need to do is psychotherapy. It doesn't mean it's all in your head, but honestly, it's a cheap way not to make you worse that can help your conscious mind grapple with what's happening to your brain and find ways around it, to find workarounds. And we recommend this for almost everything. But again, especially when you're working with complex neurological disorders, there's a lot of expensive things you can do. There's a lot of medicines that you can take that will make you worse, or certainly just leave you where you are. So we want to make sure that we're stressing things that you can do for your brain that will not make you any worse. So psychotherapy is a part of that. Resting your brain is a part of that. You may find yourself looking into infrared saunas. The heat from an infrared sauna releases brain-derived neurotrophic factor, which is something ketamine infusions do, something that prayer, meditation, yoga, earthing, all of these wholesome things that everyone tells you to do, but no one ever has time to do. Yeah, unfortunately, you're gonna have to start doing some of those. With that, there's some supplements and some amino acids that you can take. Now this, again, is long-term if you're not recuperating quickly. And this, unfortunately, does take some Google searching. You do have to be careful, of course, like I mentioned already, with trying things that are too medical and that could potentially hurt you without adding benefit. You also want to make sure not to just go buy whatever supplement Amazon tells you is the best for concussions. You'll want somebody to guide you through this process. So again, to reiterate, very short term, do I need to go to the hospital? Do I need a CT scan of my brain, making sure that nothing's bleeding? Intermediate term, to heal from a concussion, you need to take a few days off from screens. That's your phone, that's reading a book, all of that. You just need to rest your brain. And then long term, if you have problems still, which thankfully I did not. In fact, I am going to go play basketball again in a few days, but probably with a different group of people, not the ones that elbowed me in the head. Anyways, long term, when you're looking at concussions, you need to work on the mental health aspect of it. Again, not saying it's just in your head, but that will also help your brain find new pathways. I mentioned ketamine infusions. That's like a 5th, 6th, 7th line option. It's not at all something you're going to do just because you have a concussion. You're going to come visit me at Ascend Health Center and get ketamine. Absolutely not. But in many cases, you'll find an intertwining of mental health and physical health, and it'll all start from some insult like a virus infection that didn't heal or from a concussion. So those are cases where we do look at other pharmacological means to try to reprogram the brain, almost a way to reboot it, to find new pathways so that cycles of pain or depression or brain fog don't cement themselves into your brain. So again, this is Nick from Ascend Health Center. I guess this is my Nick talk, not my TED talk. If I make lame jokes, can I still blame it on the concussion? It's only been 2 weeks.